Welcome, friends. I'm your host, Dr. Chana Davis. I'm a geneticist and science communicator with Those Nerdy Girls and Fueled by Science. Today, we're going to be talking about savvy supplement shopping with Dr. Jess Steier. She is a public health scientist with expertise in research evaluation, and she is the woman behind the Unbiased Science podcast and the Unbiased Science page. I've long felt that Jess was a kindred spirit with her commitment to sharing evidence-based science with a very compassionate and clear style. So I'm really excited to connect on this topic together.
Thank you so much, and Chana, really thank you for inviting me. And I've been a fan of Those Nerdy Girls since the very beginning, back in the dear pandemic days. Really big fan. Agree, kindred spirits, and excited to have this conversation.
Awesome. So why don't we get started just with a bit about the supplement landscape and why this is an important topic to be, bringing public attention to. So I'll contribute a little bit since we've both written about and researched this topic. So I hope today we can do some back and forth and share some perspectives, which will probably be aligned most of the time. So in terms of just setting the stage, I don't know if people realize how big of a market this is. One of the stats I saw was $200 billion market, and that half of adults and 70% of older adults are taking some sort of supplement. Mm-hmm. So it's something that many of us deal with in our daily lives or make decisions around. And it's also an area that has a lot of misunderstandings and a lot of lack of education about the scientific, foundations and regulations and quality. So what would you add to that?
Yeah, I mean, I would add that I find it interesting, and I know we'll get into the regulation or lack thereof of the supplement industry, but I think folks forget, as you just pointed out, that it is an industry. I mean, I know I forget the exact number you said. I've heard even higher estimates in the trillions, or at least approaching trillions. And it's sometimes supplements are seen as the, I don't know, what's the word I'm looking for? I'll just say like the better alternative to the big pharma machine. And again, I don't think folks realize this is as well a for-profit machine. The key difference being that it lacks the safety, the efficacy testing, the regulation that pharma is so tied to. And I know we'll get into that.
Mm-hmm. Yeah, so that's it. That is a perfect segue to our first question, which is, can you, educate a bit here on how supplements are regulated and how that differs from the drug side of things? And I wonder if it makes sense to start with the drug side, because that really demonstrates what high regulation looks like.
Yeah, for sure. You cut out for 1 second, but I know we're talking about regulation. And can I start with on the drug side of things?
Yeah, I think that's a good idea.
Is that okay? Sorry, I thought I heard that's what you said. So just a reminder for folks that the drug approval process starts pre-market, so long before these drugs ever hit the market, right? They're going through rigorous testing, preclinical trials. So we're talking about animal research, in vitro research in the lab setting, as well as human clinical trials. And this has to all be done before FDA approval. So you have to, the pharma companies have to make sure, they have to make clear that the drugs that they want to reach the market are meeting those safety and efficacy thresholds, first in animals and in lab settings, and then in humans. Mm-hmm. Then once the drugs hit the market, we're talking about, FDA ongoing monitoring of the safety of these drugs throughout their life cycle, right? So this includes that post-market surveillance for adverse events. Then again, efficacy, as I mentioned, drugs are they must prove their effectiveness for their intended use through very extensive clinical trials. Again, when we say clinical trials, we're talking about in humans. Purity, so there are these very strict quality control standards to ensure the purity and consistency of drugs. And then labeling. And labeling is something we have to talk about when it comes to supplements, but speaking about drugs first, all drugs have to include extremely clear and detailed information about the drug's uses, risks, any and all potential side effects, and dosage instructions. Mm-hmm. Did you want to jump in there, Chana, or should I?
No, that's a great baseline against which to compare supplements.
Yeah. So then there was this policy that was enacted in the mid 90s. It's called the Dietary Supplement Health and Education Act of 1994. And this really set the stage for the way that dietary supplements would be regulated and how they're different than the drug regulation process. So some of the key points of this act, and sorry, I am reading these. I just want to make sure I'm hitting on all the main points. It's the definition of dietary supplements. So the act defined dietary supplements as products taken by mouth that contain a dietary ingredient that's intended to supplement the diet. And this can include vitamins, minerals, herbs, amino acids, and other substances. There was also some specification around the manufacturer responsibility. So this is a key difference between supplements and drugs, because the act places the responsibility for ensuring the safety and proper labeling of dietary supplements on the manufacturers and distributors, not the FDA. Again, key difference. So this means that supplements, they don't need the same pre-market approval by the FDA for safety or efficacy, which is the case for drugs. Then talking about FDA oversight. So the FDA does not approve supplements before they go to the market. But I did want to mention that the FDA does have the authority to take action against any adulterated or misbranded dietary supplement after it reaches the market. So this could include, if there's a big safety signal, a supplement that's deemed unsafe could be pulled from the market. Also, labeling requirements. So they do have to include supplement facts. So ingredients, amounts, and a disclaimer stating that the FDA has not evaluated any of the claims made on the label. But here's a big thing that we should talk about, that there have been several studies assessing the accuracy of labels on supplements. And unfortunately, there's a big mismatch between what's on the label and what's actually contained in supplements. So this, again, is an area of weakness when we're looking at supplements versus drugs. So just briefly, and I'm sorry if I'm rambling here, feel free to rein me in. Just to restate, so in terms of the pre-market approval, supplements do not require that pre-market approval by the FDA for safety or efficacy. So again, the onus is put on manufacturers and distributors. So there's no FDA oversight, and the FDA can only take action against unsafe supplements after they're on the market if there's evidence of harm. And then, so I'll just say just briefly here, manufacturers must follow something called good manufacturing. GMPs is it's commonly abbreviated, to ensure product quality. But again, the
Sorry, I think we lost Jess for a second there.
Oh, no.
Lost you for a second there, but looks like you're back. I think you were
Yeah.
mentioning the GMP, that they must follow good manufacturing practices that the FDA does not
Correct.
routinely test.
Exactly. So their manufacturers are supposed to follow these good manufacturing practices to ensure the quality and the safety of the supplements, but there's no routine testing. The FDA is not doing any testing. When it comes to purity, looking for contaminants, that's not happening. So again, just really underscoring that a very big difference is that we're putting a whole lot of trust in the manufacturers and distributors of supplements, and we're lacking that strict regulation, safety, efficacy testing that we have with federal oversight for drugs.
Yeah. I think, the 10-second summary is it's a bit of a Wild West. With a supplement, you don't have the same guarantee that A, it's going to actually do what is labeled on the claim, and B, that the bottle actually contains, the amount of active ingredient you're looking for, and that it's pure. But those things are assured when you take a drug that's been through the review process. But with supplements, those things are not assured. they may or may not be true. And there's, we'll talk some more about ways to kind of boost the odds that those things are true.
Yeah, no, that was so beautifully said. Thank you for summarizing.
My pleasure. So yeah, I'll take the next question, which is, how can you assess as a consumer the likelihood that if you're shopping for a product, it's going to actually deliver the benefit that you're looking for? So let's say you've maybe heard that magnesium helps with sleep, which, I read a recent headline about. And, the bottom line for that one, for example, is physicians and sleep experts in this field are basically saying, well, the evidence is kind of scant, but there's not really much harm in trying. So I'm not going to stop you from trying it, but don't expect wonders. That's kind of what you hear from relevant experts. They say, there's maybe some plausible mechanisms by which this could make sense, which is why, I'll tell you, maybe try it, but it's not that we have a robust body of studies that all show that people who take it do better with sleep. Mm-hmm. I think that's kind of a pretty typical example of maybe of the benign category of supplements that, maybe it kind of makes sense. The evidence is mixed, but that's very much not the same thing as this will help my sleep, or there's a good chance this will help my sleep. So, so how, if I wanted to know that, and in fact, I have, wanted to know the answer to a question like that, what do I do? As a scientist, I'll typically go to PubMed, which is, the resource for scientific publications, and I'll look for like a review study or a meta-analysis study, some kind of publication that reviews against a large body of studies, because one study is never going to tell the full story, because the results always, can be biased for a bunch of reasons. But if you see that, 20 different studies all find the same thing, then that gives you a higher confidence in the conclusion. So that's something that most scientists do. And that's probably how you would approach, evaluating something for yourself. But I know that that's not accessible to many consumers. And so we do really need these summary sites that can give you a more or lay audience, read on a supplement. And my best recommendation for that is something called the NIH Dietary Supplements Fact Sheet. That's one of my favorite resources. And I'm going to drop a link into the chat, and we'll also share some links later on the website. So I'm going to post that in. But yeah, so places like the NIH, which are a reliable resource that are, unbiased, because they're not going to profit financially from you taking the supplement, they can give you a good read on that. So that's one of my favorite summaries. I also like examine.com, which is science writers and communicators that providing research summaries across the evidence. Unfortunately, they've made a lot of their content under lock that used to be free, so it's harder to get the summaries that I want, but it might be worth subscribing for some people. If this is something you're spending a lot of money on already, you might find that you save a lot of money by subscribing to somewhere that will help you be more skeptical. Do you have anything to add on, like, if you were evaluating, I've heard, do I want to give my kid or myself magnesium for sleep? And like, how would you approach a question like that?
Yeah, I mean, all the things that you said, Chana. I mean, I guess the one thing I wanted to jump in on, and obviously I know you know this, but I think sometimes folks think that if there's a study, like one study that they're able to find on PubMed, for example, that does show, maybe there is one study that says, magnesium works wonders for sleep. Mm-hmm. That one study, well, first of all, taking a step back, PubMed is a repository for studies, mm-hmm. right? So simply mm-hmm. being on PubMed or being searchable via PubMed does not make a study like the be all end all, right? Yeah. And so that's why, rather than looking at individual studies, and in particular small studies or preclinical studies that maybe are conducted in rats or something like that, we mm-hmm. have to look more at the body of evidence and the scientific mm-hmm. consensus and mm-hmm. people with relevant expertise, as you said, in these mm-hmm. particular areas. So in total agreement, I feel like that's just a big, sometimes people understandably want to do their own research, but not fully understanding that, again, just the mere presence of an article in PubMed does not make it, fact. So just want to clarify. Yeah.
I think, depending on the type of problem you're trying to treat, a good way to go would be to look at the relevant professional organization. Like if it's for cancer, maybe you're going to American Cancer Society, or you're going to, North American Menopause Society for something related to menopause treatment, something that has relevant like healthcare professionals that are not necessarily selling the supplements
Right.
Directly on the website, Yeah.
Absolutely. And I know I might be jumping the gun. I know we'll get into some other third party, testing that might be seen as like a,
Mhm.
another vote of confidence for these things. But I won't jump the gun. I'll wait for us
Yeah.
to get there.
And I think the most important takeaway under this potential usefulness is to not assume that just because it's been implied by the press or because a friend found a benefit, to just really be skeptical, because a lot of times whatever is being touted is not actually well supported by evidence. And that's going to be the minority of cases where there actually is good evidence behind something.
And if I could just jump in with one thing there, I think, so many of us obviously trust our friends and family members. And absolutely, if they say, oh, I started taking this, I don't know, lion's mane or whatever it is, and I saw the X, Y, and Z positive results, we think, oh, I'll try it. Just remember, again, and I almost hate saying this, but it is so true. Like, anecdotes are not evidence. I know we, as the ones experiencing it, feel so strongly about it because there are personal experiences. But the reason we say that from a science perspective, of course, is that it's a single data point, right? And without looking at these controlled trials where we're controlling for all the other variables that might be impacting outcomes, we don't have a whole lot of confidence in the generalizability of one person's experience. So just real quickly, like, if a person starts taking a supplement, maybe they're making other lifestyle changes, and it might be that those lifestyle changes are also contributing to outcomes.
Yeah. And, just trying a supplement just in case is not actually harmless, right? I mean, it's not only is it, maybe a waste of money, but if money is not a resource, is not a limited resource for you, I worry about people kind of de-emphasizing the ways that can be most effective in handling whatever the issue is that they have. So there's an opportunity cost to taking supplements and to consider. And there actually is a real harm of someone just commented on the chat about interactions with other medications, right? These things are not benign. And so to just be making a cocktail of supplements is not without risk if you're doing it without talking to a physician, and you don't know for sure what's the purity and the dose are not going to be as rigorously guaranteed as they are with the drug. So let's segue now into our next topic, which is quality and safety of a supplement, and how can a consumer go about navigating that?
So, I mean, a big thing that stands out to me, and we alluded to this briefly before, but is that third-party testing, because this is an external entity that doesn't have a dog in the fight, right? So I will say there are some labels that maybe aren't truly valid, but there are a few third-party testers, that do stand out as being credible. So a few that stood out to me are the United States Pharmacopoeia, USP, NSF International, which I think was formerly the National Sanitation Foundation, but it now is just the NSF International, or Consumer Lab. And so these why am I saying 30 party? Sorry, third party testers, they'll test for quality and for purity. Just really want to be clear here that this does not equate to FDA approval. This is a completely separate thing. So for example, the US Pharmacopoeia, it's not a government entity, but it's, again, not FDA approval, but I will say that the FDA often references the USP standards. So that's just one way to look at it.
But just to clarify, that's around does the bottle contain what it's supposed to contain?
Exactly.
Does it contain the right active ingredient, and does it not contain impurities? That's not the same thing as will magnesium help with sleep? That's efficacy. Right. That's performance and delivering on the claim.
Absolutely right. I'm sorry if I messed up the.
No, you don't. I just think, the word quality kind of can be. You can sort of assume that quality implies it does what I hope it's going to do.
For sure. This is all about like the accuracy of labeling. Does it contain, right, what it says? And in the did you just say this? Sorry, in the quantities in which it's supposed to be present. That's a big thing as well. And also impurities and perhaps things that are not listed at all on the label that are detected in supplements. So these third-party testing entities can be helpful to instill a bit more confidence. And then, I mean, there are some other things that you can do. I mean, just even a quick search of a manufacturer, just looking into a company's reputation, some of their manufacturing practices. Are there major red flags like a history of recalls or warnings for their products? I mean, we're talking about looking at the ingredient list, but then at the same time, I'll say sort of take the ingredient list with a grain of salt, right? Because again, we're not always confident that the labels on supplements are accurate. So that's a big thing. Certainly looking out for potential allergens or contraindications. I know we started talking about drug interactions, and I think unfortunately there's this misconception in particular for like herbal supplements or if things are natural that, oh, they're natural so they can't be harmful. And that's just not the case. I just recently did a post, and this is we'd have to have a whole other hour to talk about this, but on curcumin and turmeric supplements and what people don't realize is that these supplements can actually cause liver damage. There's some curcumin-related hepatic, all these liver issues. There's also interactions with iron absorption, if I'm not mistaken. So people who have issues with their iron might want to be cautious. So again, just because something is natural or herbal does not mean that it's safe or that there can't be these interactions. And that's why it's certainly, before you start anything, you want to have a conversation. I mean, I know we're on the same page here. You want to have a conversation with your healthcare provider who knows your medical history, the medications that you're taking, any risks before you start something new.
I'm getting a comment about, this is a little bit tangential to this ingredient purity, but it's sort of related enough that I'll bring it up here. What about bioavailability and, tablet form versus getting something from your food? Do you have anything you want to say about that?
Yeah. And, I'm not a biologist, biochemist, biomedical person by any means, not a clinician, but my understanding and in all the literature I've read is that it's always better to get these nutrients from our foods, from a balanced and diverse diet. I don't know, Chana, if you wanted to comment at all specifically on bioavailability, but, and this is something I was going to bring up later. I don't know if now's the time, but it's like the folks who might benefit from supplements, people who don't have access to, a healthy, nutritious diet, they're the ones who often can't afford these supplements. And the people who are taking them already have access to the nutritious diet. And it's, and that's why the supplements really aren't doing a whole lot for those folks who actually have the means to afford them. Sorry if that was too tangential.
Yeah, I would just say from like a biochemistry perspective, bioavailability, it's something I've looked at a bit because I eat a plant-based diet and I want to be mindful of, am I getting enough iron? And so thinking about getting iron from, like iron as example, iron from meat versus iron from plants versus iron from pills. Bioavailability does depend on the context of that iron, and heme iron does absorb better than non-heme iron, but it's not the same as, it's not actually a question of synthetic versus non-synthetic. Anyways, it's I would just say there is a trend in the direction of absorption. Like eating it from your food is better for sure because you're going to get lots of other nutrients too, but bioavailability isn't always going to be better from food because there might actually be some compounds in the food that actually inhibit the absorption, just depending on that particular food and the combination of nutrients in it. Often they tend to be synergistic, but it's not something that's guaranteed. And sometimes you may even be better off having a nutrient in isolation if in nature it might be found with something that inhibits absorption. So I would just say it's not black and white. So I wouldn't rule out, synthetic nutrients in pills can definitely, I don't know if we lost Jess again. I I would just say I wouldn't rule out the idea that you can overcome a nutritional deficiency from a pill. We know that as a fact. You can overcome a nutritional deficiency from a pill. It's just that it's recommended from food because usually you're getting multiple other beneficial nutrients at the same time. So where are we now? We've kind of sidetracked, so sorry about that. Let's get a little bit personal and talk about some of our own decision making, because I think that can be helpful for people. And I'll just build on what I just started explaining about my own situation. So I think the place that supplements are going to be, dietary supplements are going to be most useful is when you're potentially going to have a nutritional deficiency otherwise. So if you are someone who eats, a nutrient-rich diet that has lots of fruits and veggies, good sources of protein, good sources of grains and fats, you're probably going to be okay. But if for some reason your diet is restricted, economic, allergies, ethical preferences, whatever it is, then you need to do kind of a scan and think about, are there nutrients of concern given my situation? And for me, I want to know, I've always had borderline iron, so that's something that I have supplemented occasionally over time. I also make sure that I get B12, and I have B12 fortified soy milk. And calcium is something that I also supplement because I have a family history of osteoporosis, and I get a lot from plant-based milks, but I just want to be careful about covering my bases there. I also take vitamin D. I'm Sorry.
Mom life, I get it.
Bronwyn, jeez.
We're humans.
I'm on camera right now. So, yes, we are humans, and I guess I can speak about my kids. I have 3 kids that are vegetarian as well. So they drink soy milk, and that's how they get a lot of calcium. But I do give them some calcium supplements, some iron. We check on that. And so really it's all about avoiding deficiencies. And yeah, I'll occasionally use protein powder because I know that my protein intake, can be kind of borderline. And so if I feel like I want to boost it and I'm working out more to supplement that, I'll use protein powder. And then when I was pregnant, I took prenatal vitamins with folic acid. So that's my profile, but it's very much designed to complement my plant-rich diet.
Mm-hmm. So, and I could jump in if I can with what I've done. And it's interesting. It's sort of evolved over time, and I'm going to be totally transparent. So I like you, when I was pregnant, I was taking prenatals for sure. But before then, I was influenced by some loved ones who I love and trust very much, who were recommending elderberry supplements and those chewable gummies. And I was taking them for a while. And frankly, they wasn't doing any harm, but it wasn't really doing it. There was no benefit either. And once I actually did some research on it and looked into the data were not compelling, and I stopped taking elderberry supplements. But it's funny, and if I can go off on just a slight tangent, I was having a conversation. I don't know if you're familiar with Dr. Joe Schwartz. He's wonderful. He's a brilliant chemist out of McGill in Canada.
Yes, I love the McGill page. Shout out to McGill. Yes. Office of Science and Society or something.
Yes. And I've had so many great conversations with him, and he shared a really interesting anecdote, and I pulled it here, and we can link to it. I know you'll share some links to stuff, but talking about eminence versus evidence, and he gave a case study, vitamin C, and I'll just jump to the punchline, and then I'll come back to the specifics of this. But we both acknowledge the data really are not all that compelling at all for vitamin C or for zinc. There's some evidence that zinc, if taken early on in the course of an illness, might shorten illness duration or lessen severity of symptoms. But it's not. There's not a whole lot of evidence. But he and I both admitted that early on, if we feel like a tickle in our throat, we may reach for some vitamin C or zinc. And I just wanted to read this. I thought this was so cool. So this is from Dr. Joe Schwartz. Again, this came from the McGill page. I saw you just linked to it. So he said, And this is a story about Dr. Linus Pauling, who's a very well-respected chemist. So curiously, in 1970, this eminent scientist who had published hundreds of peer-reviewed articles in the world's leading scientific journals penned a book claiming that the common cold can be cured with large doses of vitamin C. Incredibly, he offered no evidence other than his own and his wife's personal experience. But since Pauling was widely acclaimed as one of the world's leading scientists, the press jumped on the vitamin C story, and supplements of the vitamin flew off the shelves. And in this case, evidence had been trumped by eminence. And I love that example. And I think it's sort of, I don't know, like even knowing that there's not a whole lot of evidence, even still, this is something I do, if I'm being honest, I do occasionally reach for.
I'm going to put a link in because I do love their articles in general.
Yeah.
And it's funny, as a scientist, I do feel like I have to walk the talk and, not take things just in case, but it's tempting sometimes. Like I remember when I was having trouble conceiving, I was contemplating trying acupuncture, which I never would have contemplated otherwise. But when I felt I had no alternatives, it's like, well, maybe,
Right. Well, and sorry, I didn't mean to interrupt you. I was just going to say, I think that's the thing about, when we have these conversations about supplements and other like alternative things like acupuncture, it's that we have to acknowledge, right, that the reason that people are often seeking these things out is because they're dealing with chronic conditions or chronic pain, and they're looking for some relief. So we get it, right? It's just when we actually comb through the available evidence and data, there's just not a whole lot to support it. And then you throw in these safety issues, efficacy, lack of regulation and oversight, labeling issues. It definitely raises some red flags.
Yeah. So why don't we wrap up with red flags? What would be showstoppers for you if you're, considering, because there is a distinction between something, well, it's harmless, why not? And then this is really not something you should go near. Do you have anything to say on that topic?
Yeah, I think my big thing is if it's claiming to be a panacea, these overstated, lofty, promises of you take this supplement, it'll cut your risk of cancer, it'll, just revolutionize some aspect of your life, quantity, quality of your life. It's just, if that were the case, this would be incorporated, frankly, as a drug, and it would be incorporated into our standard recommendations. And it's just not the case. And so for me, that's a major, major red flag. And then also just the appeal to nature is a big, just a personal gripe of mine. This, it's all natural, herbal, when they really lean into that as a selling point, again, I think it's overstating or this misconception that if something is natural or herbal, that it is automatically safe or beneficial. And the reality is that we've learned quite a bit from nature. I'm not going to say otherwise. I'm sort of a running joke, like I live in the woods, like I'm sort of like a nature loving hippie, Science learns from nature. There are some examples we can go off on, like willow bark and how, that was studied and has created aspirin. But this idea that natural and herbal is better, safer, that's just a big red flag for me as well.
Well, we are pretty much out of time here, so I wanted to wrap up with just any last words of advice. I'll jump in first, if that's okay.
Please.
And my bottom line is to just be skeptical and assume it probably doesn't offer the benefit you're looking for unless you're relieving a deficiency. To me, that's an entirely different category. You might see a study that people who took vitamin C had better immune health. Well, if the people who weren't taking it had deficiencies, then of course they did. That's not the same thing as people who have enough being better off when they have more, right? So just, go like gangbusters, relieving your deficiencies and be aware of potential nutritional deficiencies, but don't expect that most things taking you from, normal to be super normal are going to be beneficial. And then if you are, needing to supplement some potential gap, then look for a third-party independent testing.
Mm-hmm. I would just, echo all of that. I know we all want there to be so wonderful. It would be so wonderful if there was a magic pill or something that we could take every day that would, greatly impact our health and well-being. My red flags are up when it comes to supplements, unless you have a diagnosed deficiency or are pregnant, or there's some other, factor that warrants your healthcare provider to recommend it for you. Don't just assume that because it's all natural or herbal that it's safe. And just, I would say, hold supplements to the same standards to which you hold the drug industry. And remember that supplements are part of a multi-billion, if not trillion-dollar industry aimed to make money as well. So just keep that in mind.
That's great advice. I want to just drop in a couple of links. For those that want, from those nerdy girls that maybe don't know you, tell me about where they can find more from you.
Oh, thank you so much. You can follow Unbiased Science. We're on all the different social media channels at Unbiased SciPod. Also have a Substack, the unbiasedscipod.substack.com, and a searchable database, uspodsources.com, where you can search by keyword and find lots. All of our always cited. And again, I just want to thank you so much for the work that you do here today.
Oh, well, thank you so much for joining me. It's been a really smooth conversation, since you and I are very much on the same page and have both, thought and researched this a lot, both for our personal lives and for sharing with others. And it is something that can be very overwhelming. So we get it, and it just does take time. You're going to have to put time in before you invest in a supplement if you want to get something that's actually going to help. So we are officially out, and I will just advise following those nerdy girls on all social media channels and signing up for our Substack, which you can get to on our website at thosenerdygirls.org. And then I also have my own page and my own Substack. My page is Fueled by Science, and my Substack is called Healthy Choices Fueled by Science. So that is it. Thank you all for joining us, and we hope to see you soon on another live. Take care. Bye.